Okay, I'm going to show you how to do a successful med pass for your med checkoff. What you'll do, you'll come in the lab, you'll have a folder that your teacher will give you. You'll also have a med bin, and what you're going to do is set up and prepare your medications first. So you'll wash your hands, you will look at your MAR, and you will take out the medications that are on your MAR. So as you're taking them out, you're doing your first check. So you're checking your medication against what's on your MAR. If there's ever a question, you need to go back to your order and make sure that the medication's correctly written down on your order. Because sometimes medications get transcribed wrong from the order to the MAR. So your first check is checking your med against your MAR. After you have checked all of your medications that you're pulling out against your MAR, then you're going to do your second check. And you're just checking another time what you've already pulled. So I'm checking my potassium, I'm checking my nitroglycerin patch, and I'm checking my Imodium liquid. You're also going to prepare the liquid, so you would pour it at eye level into your medication cup. Okay, you never want to put your cap face down on a table, you always want to put it face up. After you've prepared all of your medications, after your second check, you're going to give those medications to your instructor. The instructor is going to check your medications before you ever go to the bedside. We're not going to tell you if they're right or wrong. Okay, you're going to have to check that on your own when you get to the bedside when you do your third check. You also want to be checking for lab work to make sure that those medications are safe to give. So you'll have a scenario with your patient's vital signs. Always make sure that you take vital signs before you give medications. You'll also have your lab values there, so you'll know if you are supposed to hold a med or go ahead and give a med. So after you've checked them, you're going to go to the bedside. Make sure that you have your order and your MAR. You'll have both with you. When you get to the bedside, you're going to knock on the door. You're going to wash your hands. You're going to introduce yourself. Hi, my name is Natalie. I'm going to be your student nurse today. I'm going to be giving you your morning medications. Can I please have your name and date of birth? And you're going to check your name and date of birth against your MAR. You're also going to ask them their allergies and check it against your MAR. And he's allergic to penicillin. So I want to make sure I don't give any penicillin. Then before you ever get started, you want to make sure and tell your patient, I'm going to be doing my third check. I'm going to check these medications a third time before I give them to you. So you check again against your MAR, check each medication, make sure you have the right ones, the right dose, the right route, and the right time. After you've done that, you can go ahead and get started. If there are any medications that you have to check vital signs first, you need to make sure that's been done, or if you need to listen to their heart before you give a cardiac drug or a respiratory drug, you need to listen to lungs. Any of that stuff needs to be done before you give that medication that pertains to that body system. Okay, so what I'm going to do, I'm going to have him take a drink so that I can make sure he can swallow appropriately before I give him pills. So make sure you set your patient up. Ask them to take a sip of water. Assess if they can swallow without gagging. You're assessing gag reflex. He can swallow, so I'm going to go ahead and give him his oral medications. So I've done my third check. I've put my medication in a med bin. You can ask them if they can take their medication by themselves, or if they need help with that, you can assist them. He can take his medication on his own, so I'm going to give him his pill to take. Make sure that you watch them take their medicine. You want to make sure that they've swallowed it, that they're not hoarding it in their mouth or anything like that. This would be a time that you would teach them about the medication that you just gave. So you'll have your med sheets with you, and the medications that are on your sheet, you can refer to those for your teaching. So like I just gave potassium. So I'd want to make sure that I've checked his blood pressure and his pulse. I would want to also check his potassium level before I give potassium. I may want to listen to his heart too, just to check for any arrhythmias. And then I would tell him, you know, if you feel dizzy, alert the nurse. Make sure that you tell them, most medications make patients dizzy. So you'd want to tell him not to get out of bed without assistance, that he needs to call you to get out of bed. Make sure he has his call light with him at all times. And any other teaching that you can do that's pertinent for that medication, this is when you need to tell him. If he's not in pain, you would want to do your teaching. If your patient's in pain, this is not the time to do their teaching. You would want to wait until they're pain-free and then go back and do your medication teaching. I would also give my other medications, so I'm not going to go through all of those meds. You will have different routes of medications that you have to give. If you have to give an IM injection, your teacher will tell you where to give those injections, what site. And then when you're finished, you're going to make sure that you raise your side rail. Your patient has their call out in their hand. Ask them if they have any questions. Answer their questions if they have any. You've already given all your instructions on not getting out of bed without assistance. You'd want to wash your hands. Also tell your patient that you'll be back to check on them. So I just gave him a new medication he's never taken before, so I would come back in about 30 minutes to an hour and check on him to make sure he's doing okay. You always want to evaluate the medications that you've just given. And then I want to chart the medications I gave before I leave the room. So I'm going to have my pen, I'm going to chart on my MAR what I've just given, and then I'll come back to check on him.